Hi guys, in my previous videos, I showed you the abduction of the humerus. So abduction of the humerus, at the same time, we have the lateral rotation of the scapula, inferior angle of the scapula turning laterally. Abduction of humerus, at the same time, we have lateral rotation. Now I'm going to focus on the flexion of the humerus. When your arm bending forward, it's called the flexion of the arm. So at the same time, like the abduction, during the flexion of the humerus, we also have the lateral rotation of the scapula. Why? So the reason behind this is that during the flexion of the humerus, the lateral rotation of the scapula repositioning this glenoid cavity opposite to the head of the humerus for a great range of motion. This repositioning allows you to have a great range of motion. This is the big reason behind this. So which muscles are flexing the humerus at the shoulder joint? I'm going to show you on the plastic models the muscles that are involving in flexion of the arm at the shoulder joint. So this is the upper limb muscles. From the anterior view, you can see the pectoralis major. This is the clavicular head. It's coming from the clavicle. We also have sternal head. You can see a little bit here. It's coming from the sternum. And this is the deltoid. Deltoid has the anterior fibers, middle fibers, and posterior part. So if you look at here, the muscles that are crossing the shoulder joint anteriorly, this is the shoulder joint, they are flexing the arm at the shoulder joint. So here we have the pec major and anterior deltoid. These two muscles, you see, they are superficial and they are really large muscles. These superficial large muscles that are crossing the shoulder joint anteriorly, when they contract, they do flexion of the arm at the shoulder joint. We also have some deep small muscles. So if I take off the deltoid, you can see some muscles here from the medial view. Here we have the coracoid process of the scapula. This is the scapula. You can see the biceps brachii here, the short head of biceps and coracobrachialis. These two muscles also, they are deep and small, and assisting these large superficial muscles during the flexion. So this is the flexion, the muscles that are involving in flexion. Which muscles are involving in lateral rotation of the scapula? This is the flexion. During the flexion, we have lateral rotation of the scapula, so the inferior angle of the scapula turning laterally to the outside. Which muscles do the lateral rotation? In my previous video about the scapulohumeral rhythm, I discussed this one, but I'm going to revise it again. So we have trapezius muscles, upper trapezius and lower trapezius. Both trapezius, they are coming from the skull and the spine, and they attach to the spine of the scapula here. This is the spine of scapula. Upper trapezius coming from the head and neck, they attach here. Lower trapezius coming from the thoracic spine, attaching to the spine of scapula. We also have some muscles. They are known as the serratus anterior. Actually, the serratus anterior coming from the ribs. So imagine that this is my left scapula. Here we have some muscles. They are known as the serratus anterior. They are coming from the rib 1 to rib 8 or even rib 9, and then they go back and attach to the medial border of the scapula. The muscle fibers of the serratus anterior that they attach to the inferior angle, they help the upper trap and lower trap during the lateral rotation. So upper trapezius, lower trapezius, and serratus anterior are three muscles. When they contract, they work together as a group of muscle and they do lateral rotation of the scapula. So we also have some muscles that are stabilizing the shoulder joint. So we have some deep, small muscles wrapping around the shoulder joint, and they try to prevent the humerus gliding anteriorly. So if you look at here, during the flexion of the humerus, the head of the humerus is 3 times larger than this shallow glenoid cavity. So during the flexion, the head of the humerus tends to glide anteriorly. Some of the rotator cuff muscles, they are known as the posterior rotator cuff muscles, they prevent the head of the humerus from gliding anteriorly. So look at here. This is the spine of the scapula. Above the spine, we have supraspinatus. Below the spine, we have infraspinatus and teres minor. All these 3 posterior rotator cuff muscles, they're wrapping around the shoulder joint superiorly and posteriorly, and they attach to the greater tubercle. So during the flexion of the arm at the shoulder joint, they contract and prevent it from gliding anteriorly. I can show you these muscles on the plastic model. So if you look at here from the posterior view, this is the scapula. Here is the spine of scapula. Above the spine, we have supraspinatus. Below the spine, we have infraspinatus. And down here, we have the teres minor. As you see, all these 3 muscles wrapping around the shoulder joint and superiorly and posteriorly, and they attach to the greater tubercle of the humerus. So during the flexion of the arm at the shoulder joint, when the pec major and anterior deltoid contract, these 3 posterior rotator cuff muscles also contract and prevent the head of the humerus from gliding anteriorly. So which is known as the stabilizing the shoulder joint. So rotator cuff muscles, mainly posterior rotator, 3 posterior rotator cuff muscles are the stabilizers during the flexion of the arm at the shoulder joint. So as a quick wrap up, we have flexion of the arm at the shoulder joint. During the flexion of the shoulder joint, we have lateral rotation of the scapula, that is repositioning of the shoulder joint for the great range of motion. The flexors are the muscles that are crossing the shoulder joint anteriorly, mainly pec major and anterior deltoid. And the lateral rotators of the scapula are upper trap, lower trap, and serratus anterior. The stabilizers during the flexion of the shoulder joint are posterior rotator cuff muscles, including supraspinatus, infraspinatus, and teres minor. Thank you so much for your attention.